The Pitta dosh is increased in Sharadutu, and to treat it, we have procedures like Virechan and Raktamokshan. So we have carried out 20 Virechans. Let's see one by one. 47-year-old male came to us with erythematous papules. The lesions were Pitta Kafach with more predominancy of Pitta dosh. Hence, we carried out Virechan in this case because in Charak Chikitsastan it is mentioned Moksho Raktasya Virechanam Agre, and after the Virechan, the lesions disappeared beautifully. A 22-year-old female came to me with psoriatic plaques. The lesions were Vata Kafaj and we diagnosed this case as Sigma Kushta. So we carried out Virechan, and after the Virechan, the scaling has reduced by 50%, the itching is gone and there are no new lesions. 36-year-old male came to me with psoriatic plaques. Initially, I prescribed him Rasamanikya, Swarnamakshik, Yashad Basma, Sariva Churna, but in last 1 month, he is on Vikranta Basma. The lesion has reduced by 30-40%, but I have advised him Virechan for better effect.
Next case is a 15-year-old male who came in OPD with history of hyperpigmentation since 5 years. So I diagnosed him as Switra, and in Switra, Sanshodhan is Pradhan Chikitsa followed by Sransan and Rukshan Chikitsa. So to achieve the goal of Sanshodhan, we carried out his Virechan. For now, the lesions are in decreasing order ever since I have started with treatment. Let's see the results after Virechan.
Even I have one vitiligo case and same treatment protocol was followed in my case. But if you read Vagbhat, Nidanstan Kushta Adhyay, the first hetu they have mentioned is Vishesha Virodhani. In this case, Viruddha Ahar is prominent and hence we have prescribed Virechan.
We have this one patient of filariasis around 14 our OPD and we gave him Virechan because in Chakravarti it has been mentioned for filariasis, Lepan, Langhan, Virechan and Raktamokshan. For now he has no improvement, but let's see. We have started with Bhalatak.
22-year-old male came to me with prurigo-like lesions. The lesions were mildly lichenified and I knew the cause was Rasava Srotas Dushti because he was an UPSC aspirant and Chintyanam Chati Chintanat was prominent. So initially I prescribed Rasapachak, but when Virechan was done, the lesion has reduced by 20 to 30%, the itching has reduced and there are no new lesions and he is feeling good.
Next patient is 38-year-old female who came to me in OPD with history of psoriasis and porier. So during her Hetu evaluation, I found Prabal Pittavardhak Hetu as well as there was strong Mansik Hetu. So during the course of treatment, she has been responding well. The lesions has been stable, but scaling has been reduced, but itching symptom has been constant throughout the treatment. So I was waiting for Sharad Rutu to give her Virechan and finally Sharad Rutu came and we gave her Virechan, but her scaling increased profusely. For that I have started with Snehapan as well as other Ras Aushadhis.
22-year-old female came to me with active erythema and scaling over bilateral hand region. After the Virechan, the scaling has increased and I advised her Grutpan for the same. Patient around 40 came to me with psoriatic lesions a year back. I had treated him with medicinal treatment initially, but this year he relapsed with psoriatic lesions and this time the lesions were completely pittaj. So I advised Virechan. After the Virechan, the lesions has reduced, but after an episode of viral fever, the lesions reappeared again. So we have this one faithful psoriasis patient who comes every year for Virechan. Me and Deepmala had treated him in first year and the lesions had disappeared beautifully, but he comes every year for Shodhan because he knows na tesham punarudbhav. Once treated by Shodhan, never reoccurs. To maintain the remission period, remission is a phase when disease goes to sleep for some time. To maintain this remission period, Panchakarma procedures are important.
We have these two patients of urticaria which we diagnosed them as COAT, and COAT comes under Rakta Pradushish Vyadhi. So we gave Virechan to both of them. For now, erythema and itching has been reduced. So let's see further.
Chopa Krodadi Kupita, Vata Pittano Muketano, Shav Amlam Mandalam Vyangam, Vakrada Anyatra Nelika. So we have this patient around 40 with hyperpigmentation over face. Now you take melasma or Vyanga or Nilika, both have been mentioned under Rakta Pradoshish Vyadhi, and for treatment of Rakta Pradoshish Vyadhi, we have Virechan, Upavas and Raktamokshan. So we carried out Virechan in this case.
Similarly, we have another case of hyperpigmentation which was related to DLE and we carried out Virechan for the same.
So my next patient is 52-year-old male with history of recurrent fungal infection since 7 years. Also, he have history of recurrent abscess. So with initial Kaphnashak and Prabal Klednashak Chikitsa, next Virechan was expected as it was Kapha Pitta Pradhan. Virechan was given with Sneha Siddha with Kaphanashak Aushadhis as well as Klednashak Aushadhis such as Triphala, Musta, Daru Haridra. Also on Virechan day, Kaphnashak Aushadhi was selected.
So we have this newly formed lawyer around 23 years of age and he has psoriatic lesions all over the body. So we have planned Virechan for this case. and also advised Shirodhara to settle his mental cause.
So my next case was neurofibromatosis. It is a nerve cell tumor. We can't really do much in it, but because that patient has Pittaj Nadi as well as Pittavardhak Ahar Vihar, so Virechan was carried out in with the aim of reducing the disease activity.
First motive of Ayurveda is Swasthasya Swasthya Rakshanam. Hence, this Virechan was carried out for maintenance of
So
health.
can you tell me about your next two acne related cases?
Okay, so I have this 22-year-old female with acne rosacea, and in her case, Vidai Annapan is positive, which is Rakta Dustikar Hetu. And if you read Rakta Pradoshit Vyadhi, they have mentioned Astra Mandal, and that is why we carried out Virechan in her case.
And what about your next case?
Next one is interesting. So if you read Rakta Dustikar Hetu, they have also mentioned Atab Sevan, which is positive in this 24-year-old male, and that is why we carried out Virechan in this case also.
Because it is Rakta Pradosh.
Yeah.